Lupus patients commonly get a rash on their face, which appears like a butterfly. Consequently, the butterfly has become a symbol for lupus. But there's another meaning for the butterfly, which is one of hope for patients with lupus. So lupus is an autoimmune disease, which means immune system targets self. Now, this attack in lupus, unfortunately, can be on every organ in the body, which makes it incredibly complex and potentially serious and fatal.
My first symptoms occurred when I was about 7 years old. I had mouth problems.
I had a lot of unexplained illnesses such as recurring infections.
Scott always was a very healthy, normal child, and one day he came home from school on a Friday and walked in the door, fell to the floor, and said, "I hurt everywhere. Don't touch me. Please don't touch me." And I took his temperature because I realized he had a fever. He had 103.5 fever.
The hair issue was major for me. I used to have this long, thick, pretty hair, always, my entire life. And when it started coming out, literally in patches, that was a major concern.
The fevers continued and the symptoms continued. The doctor wanted us to take him to an infectious disease specialist because he couldn't figure out what was wrong with him.
You could go to 4, 5, 6 doctors, which is the average for patients with lupus, with whatever complaint you have, and they may not recognize that you have this disease.
Every doctor finds another thing wrong with him, and that's very, very disheartening. Because you just can't believe that this child who's so cute and so normal and so adorable can have this many things wrong.
From the time I had my first symptoms until the time I was diagnosed, there was a 21-year time lapse. 21 years.
We need to continue to educate our physicians so that they can identify patients with lupus and make the appropriate diagnosis. The Office of Minority Health has developed a curriculum for medical students specifically targeted at lupus. And the curriculum is meant to educate medical students, who will be our future doctors, on how to diagnose and identify patients with lupus. An interesting story recently of one of my patients who told me about, in her neighborhood, how one of the women in the neighborhood had breast cancer. And so all the women in the neighborhood got together and decided they were going to make meals and help her while she was going through chemotherapy and radiation. And it was a great community effort to help this woman with breast cancer. And at the exact same time, my patient with lupus was getting chemotherapy for her kidney disease related to lupus. Almost the identical chemotherapy as the woman with breast cancer. Didn't she deserve the same empathy and attention from her friends and family? But it wasn't there for her.
That's part of the problem with this disease, that people can look so good and be so sick. And I would just hope that there could be more research into this disease and that it could be recognized as being as devastating of a disease as it actually is.
The typical reaction I get from coworkers when they learn that I have lupus is, "What is that?" I've heard of it, but I'm not really sure what that is.
I really did not have any knowledge of lupus until after I was diagnosed. I had heard the term before, but I didn't know what it meant. No one ever spoke about it.
I did not know a thing about lupus. I had never heard of it. I didn't know if it was something that I would have to live with forever.
The federal government is coming to the table with helping increase awareness. The Office on Women's Health is sponsoring an ad council campaign to increase national awareness of lupus.
Could I have lupus?
I'm definitely seeing a change in the public understanding of lupus. People are aware of the term now. There have been commercials, there have been print ads. When I go to a rheumatologist's office now, I usually see a pamphlet about it. That's something that I definitely never saw 10 years ago.
Through the Lupus Foundation, I think that they're doing a tremendous job in trying to make sure that their outreach is as broad as possible. There's a great effort to really reach people, educate them, give them some knowledge of what's going on with so many people.
I consider this a period of transition. There is clearly excitement in the air now. Why? We have made great progress of coming out of the old paradigm of awareness and research in lupus into a new paradigm for the disease, but we have a long way to go. We have a lot more work to do, and we have to keep the momentum going. So what do we need? We need more federal funding to increase research. We need a continued investment from industry to develop new drugs. One drug will never be enough. We have to continue to increase awareness of lupus, and we have to continue to educate our physicians so that they can identify and diagnose lupus. We need to finish the job, and we need to find a cure.